In the last 2 years of life, they spend something like 70% of all the healthcare money is spent in the last 2 years of life, because these are heroic measures for people who already have one foot in the grave. They're already very, very, very sick, and medicine's doing everything to try to keep them alive. The average 50-year-old, okay, again, I'll be 54 in 2 weeks, 2 weeks from tomorrow. So you guys have time to prepare my gifts, etc. The average 50-year-old consumes, I think, 3 medications, 3 prescription drugs every day. And by the age of 60, I believe it's, I forget now, I believe it's 5, and then 6 or 7 by the age of 70, every day. So that's in the U.S. It may be different in Scandinavia. It may not be that different. Today, 50% of Americans die of cancer. It's probably not so different anywhere else. 50% contract cancer. They don't all die from it. 50% get cancer. Heart disease is number 2 now. It used to be number 1. Heart disease is something like diagnosed with a very rare and very difficult cancer 2 years ago. Had many organs removed as a result, is still functioning at 53, but it's now coming back. And so he was talking about what else he can do, because medicine, he's a doctor, by the way, and I pointed out to him, you realize that the treatment didn't address the cause of the problem. So what was different in his body and the bodies of that 50% who develop a problem, and in our bodies? Theoretically, I've got cancer cells forming right now, so do you, although we're probably not going to develop a problem with cancer. Why not? Well, it's simple. It's a question of whether the immune system is strong enough, whether there's enough vitality in the body to recognize and extinguish those cells before they create a problem. When systemic cancer develops, you're looking at a body that is either very low in vitality, very high in toxicity, very low in hydration, or perhaps all of the above, okay, which often happens. These things come together. The more toxic you are, the lower your vitality tends to be. It's not a direct correlation, but it's a pretty close relationship. The more dehydrated you are, the more toxic you tend to be, so it's also usually involved. The more dehydrated, toxic, and acidic the body is, the harder it's going to be for the immune system to do its job properly. The 50% who don't develop problems, those are the 50% whose bodies are healthy enough, not necessarily healthy, but healthy enough to say, okay, let's get rid of that cell before it becomes problematic. Okay? But yes, understand, today 50% of Americans develop cancer. 50%. And this is why, I may have mentioned to you recently, we were talking about paint not so long ago. I walked into a paint store in the U.S. and said, do you have 0 VOC paints? The guy said, no, why do you want that? I said, because regular paints are carcinogenic. And he said, so? Well, so I'd like to avoid things that cause cancer. Call me crazy. Cancer is a very real issue. So let's eliminate those things from our lives that are so toxic they're likely to create cancer in the body. Okay? All right. Any cancer-related comments or questions?
My mom had a best friend die from cancer a few years ago, and as he did chemotherapy, now they're in 9 months gone.
Well, again, the comment was about chemotherapy. Statistics, it depends on who your sources, etc. The latest statistic I saw said that 90% of the time chemotherapy fails. 97% of the time it does not succeed in stopping the cancer or eliminating the cancer. 97% of the time. Now, given its toxicity, who would do that? Well, no cancer doctor would do it. Every cancer doctor asked said they would never do chemotherapy. They would never do chemotherapy. They understand how toxic this is. I mentioned this recently, but I learned just recently, I don't know if this is true, I was told that chemotherapeutic drugs are sold to the doctor who then resells them to his patients. In other words, marks them up as much as he wants to. When your doctor writes a prescription for any other drug, he's not getting paid for the drug. You're taking that piece of paper and going to the pharmacy. Now, the drug company may be offering kickbacks to the doctor under the table. I mean, this used to happen. I dated a pharmaceutical rep years ago before I realized I don't really want to date a pharmaceutical rep. But I dated somebody who was involved with selling pharmaceuticals years ago, and there was actually a big scandal because the government had decided to crack down on this. And they were offering doctors all kinds of fancy vacations and cars and all kinds of stuff for the more prescriptions they wrote for particular drugs. So if it's happening today, it's probably, at least in the U.S., it's happening under the table. But with chemotherapy, it's not under the table because the doctors buy it. Okay, if I'm the doctor, this is my chemotherapy drug. I can sell it to you for whatever I want, however much you'll pay me for it. So let's just consider the possibility that there may be some doctors who are looking at this as a big opportunity, as an opportunity for a big payday, because they can sell it for however much they want. Okay? The fact that it cost me $1 doesn't prevent me from reselling it to you for $100 if you're willing to pay me for it. Unfortunately, one of the things that people with cancer have in common is they're often desperate to find an answer. People get very frightened when they are told they've got cancer. Okay? And so, my guess is there probably are people, and again, I'm not suggesting this is every MD. My brother's an MD. One of my cousins is an MD. Many of my favorite people are MDs. And I know these people that I've just mentioned, they care deeply and want to do the best they can. They're doing what they believe in, what they understand, and what they think is best for people. But my guess is there may be other people out there who are using this and taking advantage of people, taking advantage of people's trust in them as doctors to line their own pockets. I told you guys recently about my experience with a surgeon who told me one thing and then, did something completely different behind my back, just greedy in the name of getting as much as he could. And it's unfortunate, but obviously there are people doing that in every area of life. It's just that doctors sometimes, especially with cancer, I think, have a tremendous amount of power because people are so frightened and so willing to do anything. Okay? It's funny, people sometimes talk about how expensive it is to fast. You guys probably have some idea of what it costs to go get conventional medical treatment for a serious disease. There are many people who wind up bankrupt. Okay, if they have insurance, the insurance may be paying hundreds of thousands of dollars for ongoing treatment. And in some cases, eventually says, that's it, we're done, we're not paying anymore. And then people are left to their own devices. So, it's funny, people, and I mean, many people pay health insurance premiums for decades and pay thousands of dollars to an insurance company so that they can have unlimited medical treatment when they need it. And people tell me that I'm charging too much money, where you spend $4,000 or $5,000 here, and if you make good choices, you will probably never get sick, never have to worry about this, never need to pay another health insurance premium. You might want to have something in case of an accident, but I think I've told you guys, I've had no health insurance for the last 27 years. I've been uninsured. I'm willing to do that because my insurance is the choices I make. By taking care of myself, I don't have to worry about getting sick. Okay? I don't know of a cheaper way to ensure your health than getting your body clean and then making good choices. Anyway, if there's no other questions or comments, I hope that's been helpful to you. Just a couple things to think about with regard to cancer. One more idea, whether it's radiation or chemotherapy or whatever it might be. In fact, let's open it up a little bit more. Let's say that we're we're in California, or many parts of the U.S. now, and what we've got access to is cannabis. So we're using cannabis oil, okay? This is the oil from marijuana plants. Well, we're smoking marijuana. We're using some form of cannabis to help treat cancer. Now, let's say that we kill the cancer, okay? Or some other magic substance that someone comes up. I mean, you know, every once in a while you hear about these cures, these things that supposedly eliminate cancer without harming the body, as THC or cannabis oil, hemp oil, is supposed to do. Let me just be clear again and say something I've said before, repeat it to reinforce it. Understand that it's not likely that anybody develops cancer because they had a deficiency of cannabis in their body. What's my point? My point is, if you kill the cancer cells by using cannabis or some other substance, you're not doing anything about the cause of the problem. So there's nothing wrong with destroying cancer that way, and if you can kill the cancer cells without harming the body the way radiation and chemotherapy does, it makes a lot more sense to me to use cannabis than maybe doing nothing. However, you still need to take a look at why this cancer developed. You need to look at your emotions. Are you walking around with suppressed anger, which has been linked directly to causing cancer? Are you living in a toxic environment? What does your diet look like? Have you given your body a chance to cleanse and heal? If you have a way to destroy those cancer cells without harming the body, do it. Why not? But also, do what you need to do to then get your body clean and healthy and keep it that way. Because if you don't, you're probably going to see what I've seen over and over again. We've seen a lot of women come in over the last 19 years with breast cancer. And I often see them when they've had a recurrence. That was true for the intern who was there when you were there. She'd already had cancer on one side. She'd already had, I don't remember her particular case, but in general, they've already had surgery, either a lumpectomy or a mastectomy to remove the breast, or a radical mastectomy where they've not only removed the breast, they've removed lymph nodes, they've removed muscle. This is disfiguring surgery. They've had chemotherapy and or radiation, but that's all they've done. And so they survive the medical treatment if they do. Many people don't survive chemotherapy and radiation, but let's say they survive the treatment and the cancer is gone, and their doctor says, you're all set. You've got a clean bill of health. You're perfectly healthy. Remember, they didn't develop cancer because they had a deficiency of radiation or chemotherapy. Okay? If those people don't go back and make better choices and give the body a chance to cleanse and heal, there's a very high chance they're going to wind up with cancer in the other breast or somewhere else in the body. And so this is what happens over and over again. People get conventional cancer treatment and they are usually back for more treatment within a couple of years. Okay? This doesn't work. It doesn't work. Again, kill the cancer cells if you can without harming the body, but then give the body a chance to cleanse and heal and actually get healthy, and you might see something change. Better yet, by simply fasting, doing the whole thing at once, if that works. If someone has very aggressive cancer, maybe it's too late, and they can benefit from hemp oil, I'm all in favor of that if that helps somebody. But I'm also clear, hemp oil doesn't heal people. It might kill the cancer, but it's not creating health. It's only creating dead cancer. Okay? If we don't address the underlying issue, the cancer will return. It virtually always does. Right. So at the same time, if they're taking hemp oil, at the same time they can be making better lifestyle choices. Sure. Well, the one thing they probably can't do while taking the hemp oil is fast. So kill the cancer with hemp oil. Eat the best diet you're willing to. Fast and give your body a chance to truly cleanse and heal and get rid of any garbage, including the toxins from the hemp oil, because cannabis does contain toxic compounds. And then you can probably continue to make the best choices possible and live cancer-free without worry for the rest of your life. Okay? So I hope that's been helpful to you. I will see you next time.